Swiftsure Innovations intends to change how we approach oral care for critically ill patients on a global scale. Excellent oral care is established as a preventative mechanism for VAP, the most fatal and costly of all hospital-acquired infections. There's two parts to the system, the one-time use endotracheal tube and the daily replaceable mouthpiece. This system allows us to separate the mouth and nose from the lower aerodigestive tract so we can do a great job of rinsing it out. We expect a TAM in excess of $600 million in the US, and we have a priority filing date with the USPTO of June 2020. The complete care endotracheal tube is placed in the trachea of a critically ill patient. The subglottic cuff is inflated to provide a seal required for invasive positive pressure mechanical ventilation. When the patient is stabilized, routine nasal and oral irrigation can begin. The mouthpiece is placed and tied around the neck. This mouthpiece opposes the patient's lips and creates a seal around the endotracheal tube. The supraglottic cuff is then inflated to create a fluid-tight seal, isolating the nasal and oral cavities from the lower aerodigestive tract. The system is connected to wall-mounted suction. Irrigation fluid is suctioned through a fenestration above the supraglottic cuff. Fluid travels through a lumen within the wall of the endotracheal tube. Nasal irrigation is administered to each nostril using a nasal atomizer. Oral fluid is instilled through ports in the mouthpiece, and fluid is sprayed multidirectionally within the oral cavity, allowing for all areas of the mouth to be thoroughly rinsed. The procedure is completed by deflating the supraglottic cuff and then irrigation and suctioning of the subglottic space. Finally, the mouthpiece is removed. This method is fast, efficient, and effective, and will be coupled with ventilator checks and completed every 4 hours.